we're not talking football and sports here. You want to get to the heart of the matter for a man. Talk about his children.
Please slow down. First things first.
Building Community is an award-winning video series created by the Chester Housing Authority to stay in better touch with its residents, staff, and the general public during these times of social isolation. Thank you for tuning in as Executive Director Steve Fisher and Ulysses Butch Slaughter bring interesting guests to discuss important topics of the day.
Fathers don't live in a vacuum. They are in this. They're in a space. They're in the world, and they have to work. They want some form of recreation with their children. They require everything that a mom requires, right?
Mm-hmm.
Um, how is it? How do you deal with employers? When you said earlier in this conversation, you asked three questions, and those questions around when was the last time you had a conversation? I forgot what the other two were, but there's this notion that how people sometimes say leave your personal stuff at home.
Mm-hmm.
But like when it comes to a mom who needs to go on maternity leave, nobody would ever say leave that at home. But for a father, it's a different approach. How do you get employers and other supportive services to buy into the fact, or buy into the idea, I should say, that fathers need as much space, as much support as moms, if, as Karen said earlier, this family thing is going to work? The fathers need as much support. How do you convince people of that?
Mm. One of the books that I found to be very helpful in terms of giving me an understanding how these things kind of work together was a book called The Color of Welfare. And in this book that was written by a professor out of the University of Florida, she said that um, the reason why you don't have comparable time allocation for maternity leave, right, in the United States as you do in Western Europe is because of slavery. When slavery enters the equation, everything changes. So people will create policies and create situations that's against their own best interest because they're serving a false concept of race. So in that book, she was saying that um, when you put in slavery in the American context, you would see we get 6 weeks. In Europe, I think they get a year in some places, right? So if you do a compare and contrast between the United States and other Western civilized countries, nations, you would see we at the bottom when it comes to the salary we pay nursery teachers, the salary we pay teachers, the salaries, anything that has to do with mothering, that has to do with nurturing, we at the bottom. And then you add and you put race in the side of that, then the bottom just gets lower and lower. So we have to show that it's to that agency's advantage to include the father, because how much money are we paying on prisons? Right now, the way that this country decides how many prisons need to get built is by looking at the reading scores of fourth graders. They look at those reading scores, they see how many people are reading below grade level, and they said, well, these people more likely than not are going to turn to crime as their source of income. And therefore we need X amount of prisons. That's a terrible situation to be living in, where education is used as an indicator of how many prisons needs to be built. So when we show how much money is being paid to prisons, how much money is paid in terms of health benefits, all the negative, the deficits, we got to show the relationships of how these things are connected. And when they see that, wait a minute, it's too, you want to increase your bottom line. You want to, what if it's money or if it's services, how do you increase that? Well, you increase that by changing the formulas that's going to give you the results that you're looking for. So that's the approach that I would suggest, and Karen might have some ideas about that as well.
Well, again, following up with Dr. Mewitt, That is another system that we see currently in our society. The way that our employment system is structured is rooted in historical racism. That is a fact. But when I think about your question about how do we convince our employees and employers and our community-based organizations that dads really need this support, is a lot of what Dr. Mewitt spoke to, but it's also hearing from these families,
Mm.
letting them speak and say what they would have wished they had happened, how they would have, if they had had this type of support, how their outcome or their circumstance might have been different. Listen, we are used to seeing women cry. That is not new to us. But when you see men break down, um, we're not talking football and sports here. You want to get to the heart of the matter for a man, talk about his children, talk about his seed, and give families that space to share the trauma that they've experienced over time by not having that support. And even in many cases, they don't realize that it's a support that they need. So at first, they may not value it, but I have supported dozens of families who have said, I would have not done this way had we not had a doula to give us this education. And doula work is a lot about birth. It is a lot about maternal health, but it's a lot about mental health as well.
Mm.
And a lot of what I do is listening. Listening and assessing for things that people don't say, but that I do see, and giving families the tools to communicate one with another so that they can have some different outcomes. So we need to hear from families. We need to let them talk about what they need.
Steve, is it fair to say that Fathers the Talking sessions are like mini summits? So if you added up those Fathers the Talking conversations, that they in pieces would equal a summit. The things that we've talked about could be the makings of a summit.
Sure. We even got we even got a piece of the summit, didn't we, when they asked us to do one of our sessions in the breakout. It was easy to do. It just once you form the gathering, the conversation just naturally follows. Why is that? Because so much has gone unsaid over the years.
Yeah.
So we're unleashing this force of energy that's been just pushed to the side, and its time has come. So
we're already talking then about the months to come. We've had a conversation about doing a fatherhood film festival. We're talking about having different types of engagements. We got to make sure that people know how to reach both of you. And Karen, before you go, you've dropped the term doula, and I'm willing to bet there are enough people out there that don't know what a doula is, that you might want to explain that.
Okay, that's a good point. So I am a birth and postpartum doula, and
Spell that, please, Karen.
DOULA.
Okay.
And I'm also a doula trainer, and doulas provide support to families during pregnancy, at the labor, and then again when they bring home that new baby or there is a completion of pregnancy. And that could be any type of family, adopted families, all kinds of families. And so that support is non-medical. That is the key, because a lot of people think about doulas, they think about midwives. It's non-medical, so a lot of it is focused on the family's needs. Beyond that, we let the medical providers handle that part, but all of those mental health, emotional needs, all of the things that are going to reduce stress for families, and making sure that they're educated on what their options are, what informed consent is, and just all those great things about how the body works to have babies naturally, if that's their choice. So doula work is birth work, essentially. Yeah.
And so we were talking with some men about being doulas, and you actually, and I think Onaje has
Yes.
gone through your training, right?
Yes.
Yes,
He was signed up for one of your upcoming classes.
no. I'm
Was he?
already I had my first level of a doula, but at the same time, I was, finishing my doctorate program, so I didn't give it the attention that it needs to. So I'm going to take it again. But I want to say, with respect to doulas, right? So the term doula with the A has been used, but I'm a
Yes.
doula with the
That's right.
O.
Close.
O is
Yes.
masculine, right?
Yes.
All right. I just want to make sure that people know how to reach both of you. How do people get in contact with you, and what are people looking forward to in the upcoming months? Let's start with the contact.
Well, I can be reached at KMP, which is my initials, doula service at gmail.com. You can also call me at 610-809-1487 if you are interested in doula services or becoming a doula. And my next training is August the 28th and 29th. I have one following in September and October.
And people can reach out to you at those contacts. Okay, they contact you.
Absolutely.
Great, great.
So
Brother Najee,
now,
how do people reach you?
okay, so now comes my moment of embarrassment because I cannot find my work phone. So if you call my work phone number and you don't get me, it's because I haven't found it yet or I haven't replaced it yet, but I'll give you both. That's 215-990-1279. But my personal phone that I haven't lost yet, and I don't plan to lose, is 646-662-0217. And my email is working. I didn't lose that, right? Because it's attached to the computer. That's OMUID at Delco, DELCO Foundation, FOUNDATION.org. Onaji Mawid at delcofoundation.org. So that's how one can get in touch with me. And we want to invite you to come on to the Fatherhood Engagement Committee because the work can only get done when we have workers to do the work.
Thank you, sir. Steve, any closing thoughts?
No, I think our guests said it all, covered it all. As usual, when we have good guests, and we always have good guests, we realize that there's 5 or 10 other topics we could have delved into and made this hours long, but we're not going to do that out of respect for everyone's time. But we will hope to get them back with us to dig deeper into some of the things we just had a chance to brush on today. They are definitely worth going further on. I'm particularly interested in going into some of the differences that we find over the decades and centuries on how we treat ourselves. The difference between, say, Europe and the United States, or we can compare other regions of the world, but as to how those things have come to be and why, and what's at the root of all of them. Today was about the follow-up on the Fatherhood Summit, and hopefully we covered that pretty well.